Unlocking Your Energy, a clinical pharmacist's guide to hypothyroidism and levothyroxine. Hello, everyone. Today, we're diving deep into hypothyroidism, a prevalent condition affecting millions globally and, more importantly, exploring the critical insights for managing it with levothyroxine, the essential hormone replacement that empowers your well-being. Understanding your thyroid, the body's master regulator. At the core of our discussion is the thyroid gland, a small butterfly-shaped endocrine gland nestled at the base of your neck. Though compact, its role is monumental. The thyroid acts as your body's metabolic maestro, orchestrating energy utilization by producing vital hormones, thyroxine, T4, and triiodothyronine, T3. These hormones are pivotal for regulating metabolism and ensuring efficient energy conversion throughout your body. In hypothyroidism, this crucial gland becomes underactive, failing to synthesize adequate amounts of these hormones. This deficiency fundamentally disrupts your body's metabolic processes, leading to a cascade of observable symptoms. When your thyroid function is compromised, the insufficient hormone levels manifest as a noticeable slowdown in your body's energy pathways. Common indicators include pervasive fatigue and a general sense of sluggishness, often accompanied by heightened sensitivity to cold, a slower heart rate, and diminished exercise tolerance. Beyond these, individuals might experience increased hair loss and brittleness, persistent constipation, and elevated cholesterol levels, which can unfortunately heighten the risk of cardiovascular disease. For women, hypothyroidism can disrupt menstrual cycles, and if left untreated during pregnancy, significantly increase the risk of miscarriage or impair fetal development, due to the critical role thyroid hormones play in growth. Levothyroxine, your lifelong ally in hypothyroidism management. A common and critical question arises: can hypothyroidism be cured? In the vast majority of cases, an underactive thyroid gland that produces insufficient hormones represents a permanent, irreversible condition. However, this is where levothyroxine emerges as a game changer. This synthetic thyroid hormone, administered orally, effectively replaces the hormones your thyroid can no longer produce. This means while the underlying thyroid condition is permanent, the symptoms are entirely manageable. Levothyroxine thus becomes a lifelong commitment, a consistent daily regimen to restore and maintain your body's vital hormone balance, thereby alleviating the debilitating symptoms of hypothyroidism. Levothyroxine, L-thyroxine, or T4, is efficiently converted into the active T3 form within your bloodstream. Its relatively long half-life means that a single daily dose is typically sufficient, offering remarkable convenience in patient management. A significant advantage is that once your physician identifies your optimal dosage, it often remains stable over extended periods, simplifying long-term treatment. While the initial phase may involve more frequent visits for dose titration, achieving a stable dose allows for a streamlined, consistent approach to therapy. Mastering levothyroxine, a guide to safe and effective use. Levothyroxine's absorption and efficacy are remarkably sensitive to various physiological and external factors, making meticulous management of interactions paramount for optimal therapeutic outcomes and to mitigate potential adverse effects. Adherence to your physician's precise instructions is non-negotiable for safe and effective use. Dosage and administration, precision is key. Your levothyroxine dosage is highly individualized, determined by factors such as age, specific medical conditions, body weight, critical thyroid hormone test results, particularly TSH levels, and your unique physiological response to treatment. Never independently adjust your dose or discontinue the medication. Timing is critical for optimal absorption. Levothyroxine is absorbed most effectively on an empty stomach, ideally 1 hour before your first meal or at least 3 to 4 hours after your last meal, before bedtime. Always swallow the tablet whole with a full glass of plain water. For pediatric patients or individuals with swallowing difficulties, the tablet can be crushed and mixed with a small amount of water for immediate consumption. It is imperative not to mix levothyroxine with formula or any liquids other than plain water. Consistency is vital. Taking your medication at the same time each day helps maintain stable hormone levels. Whenever possible, maintain the same brand of levothyroxine. Different generic or brand formulations can have subtle variations in bioavailability. If a brand change is unavoidable, notify your physician, who can monitor your thyroid levels and adjust the dosage accordingly to ensure continued therapeutic efficacy. Crucial considerations for safety and efficacy. Navigating drug and food interactions is essential for effective levothyroxine therapy. Certain foods can significantly impair its absorption. These include calcium and iron-rich foods, dairy products, fortified juices, red meat, spinach, fortified cereals, high-fiber foods, whole grains, beans, cruciferous vegetables, and soy products, soy milk, tofu. Even coffee can reduce absorption by up to 30%. To counteract these effects, always administer levothyroxine at least 4 hours apart from these substances. Wide array of other medications can also interact with levothyroxine, potentially reducing its effectiveness or exacerbating side effects. It's crucial to inform your healthcare provider about all medications, including prescription, over-the-counter drugs, vitamins, minerals, and herbal supplements. Notable interacting medications include antacids and calcium iron supplements, which should be taken at least 4 hours apart from levothyroxine due to reduced absorption. For patients with diabetes, thyroid hormone replacement may increase the demand for insulin or other anti-diabetic agents, necessitating frequent blood glucose monitoring and potential dose adjustments. Levothyroxine can also potentiate the effects of anticoagulants, e.g., coumarin derivatives, by displacing them from plasma proteins, thereby increasing the risk of bleeding, particularly in older patients. Close monitoring of coagulation parameters is essential during co-administration. Estrogen-containing medications, oral contraceptives, hormone replacement therapy can increase the binding of levothyroxine to plasma proteins, potentially increasing the required dose. Other compounds, such as sucralfate, cholestyramine, colesevelam, colestipol, sevelamer, orlistat, simethicone, lanthanum, and sodium polystyrene sulfonate can also diminish levothyroxine absorption and should be spaced by at least 4 hours. Combinations with ketamine, maprotilene, or sympathomimetics may induce hypertension and tachycardia, while selective serotonin reuptake inhibitors, SSRIs, might reduce levothyroxine's efficacy. The effects of cardiac glycosides, digitalis, can also be attenuated when co-administered with levothyroxine. Regular monitoring and follow-up appointments are integral to effective management. Your physician will schedule periodic blood tests, primarily TSH levels, to assess hormone concentrations and guide dose adjustments. Initial dose titration may involve more frequent testing, every 4 to 6 weeks, gradually extending to every 6 to 12 months once stability is achieved. Maintaining a log of your symptoms, example, fatigue, unexplained weight changes, mood fluctuations, heart rate, and sharing these observations with your doctor is highly beneficial. While generally well tolerated at appropriate dosages, potential side effects can emerge if the levothyroxine dose exceeds your body's requirements, mimicking symptoms of hyperthyroidism, overactive thyroid. These include unintended weight loss, anxiety, irritability, restlessness, palpitations, rapid or irregular heartbeat, excessive sweating, heat intolerance, tremors, diarrhea, abdominal cramps, insomnia, headaches, and hair loss, which often stabilizes after the initial treatment phase. Promptly contact your physician if you experience any concerning side effects or unusual bodily sensations. In certain situations, temporary discontinuation or dose reduction of the medication may be necessary. Special populations require tailored considerations. Levothyroxine is safe for pregnant and breastfeeding women. However, thyroid hormone needs frequently increase during pregnancy, necessitating close monitoring and dose adjustments. Post-delivery, the dose may require further recalibration. For elderly patients and individuals with pre-existing cardiac conditions, treatment typically initiates with a lower dose and is gradually escalated to mitigate cardiovascular complications. Those with other medical conditions, e.g., heart disease, diabetes, adrenal insufficiency, pituitary insufficiency, must provide a comprehensive medical history to their physician to ensure appropriate dosage adjustments and management strategies. Lastly, proper medication storage is vital. Store levothyroxine at room temperature, 15 to 30 degrees Celsius or 59 to 86 degrees Fahrenheit, protected from light and moisture, and out of reach of children, as it is susceptible to degradation from light, heat, and humidity. We hope this comprehensive guide has empowered you with a deeper understanding of hypothyroidism and the critical nuances of using levothyroxine safely and effectively. Remember, consistent adherence to your treatment plan and regular follow-ups are your fundamental tools for robustly managing this condition and optimizing your quality of life. Never hesitate to have an open dialogue with your doctor or pharmacist about any concerns or symptoms you encounter. Do you have any further questions about managing your levothyroxine or perhaps about other aspects of living with hypothyroidism?